pag hindi kami bumiyahe dahil wala kami pera, wala kami pambiling bigas. Mahirap.
This group, they have never said anything good about government response.
During the COVID-19 pandemic, physical distancing and isolation were the new normal. It has been 2 years since the entire world began to deal with this ordeal and its devastating consequences. Numerous families have lost their loved ones, others have lost businesses and jobs, and many have lost their hopes to live another day.
Not only are we talking about an outbreak, but we are also witnessing an increase in the level of anxiety that the majority of us are feeling right now. As a result of the lockdown, we are all stuck at home, unable to go about our daily lives as we used to. And for most of us, being in some type of isolation or quarantine would have been a source of mental distress. This is causing us to alter our lifestyles, our performance, and how we interact with other people. And undoubtedly, these transformations have never been easy. Thus, the government must pay equal attention to the expanding mental health crisis as they do to the economic concerns.
When the COVID-19 pandemic hit the Philippines, there has been an increase in mental health concerns. A study by Mind Nation reported that about 50% of Filipino workers had experienced mental health issues during the global health crisis. Moreover, for the first half of August 2020, the National Center for Mental Health Crisis Hotline received an average of 53 suicide-related calls every day. In 2020, the Philippine Statistics Authority reported that about 4,000 Filipinos died due to intentional self-harm. Those numbers were 57% higher than that of 2019. Despite these, the government's efforts to address mental health concerns are lacking. We should be reminded that these data are not simply numbers or statistics. These are real people dealing with a crisis that needs to be helped. Thus, just as much as we strive for an economic recovery, we are urging the government to pay equal attention to the expanding mental health crisis in the country.
At a time when the world has collectively experienced its most challenging year by far, we have a collective responsibility to keep societal well-being at the forefront of our response and recovery. Policymakers and leaders should indeed perceive, acknowledge, and address the existing deep inequities in access to mental health care. As such, we must make mental health a reality to everyone, everywhere, always. Remember, there will be no health if there is no mental health.